Hi, this is Dr. Kingston, and in this video, we'll be talking about the Pterygopalatine Fossa, its walls, and its boundaries. Our objectives, basically to do just that, describe the walls and boundaries of the Pterygopalatine Fossa. Now, there are a couple of ways that you can access the Pterygopalatine Fossa. The first is to break open the lateral nasal wall, like you've seen in some learning objective videos for this session. And that makes sense for this session because we're focusing on structures of the nasal and oral cavities and the palate. These are all internal things. But there is a way to access the Pterygopalatine Fossa without breaking any bones, and that is from the external cranium through a passageway called the pterygomaxillary fissure. But before we find that fissure, it's a good idea to orient yourself to these images because they're not particularly intuitive. So on the left here is a lateral view of the skull zoomed in on the infratemporal region. The bones making up the walls in this area are all nicely color-coded and labeled. So you've got maxilla in orange, zygomatic and temporal in kind of a purple, sphenoid in green, and palatine in a sky blue. On the right side, what you're looking at is just the opposite side of the image on the left, okay? So this little bit of maxilla that you can see over here is the same bit of maxilla that you can see over here. It's just the inner surface of it. So here you're looking at it through like the maxillary sinus instead of the outside of the bone. All right, same with the zygomatic and the sphenoid. All right, so now that we've got ourselves oriented, let's pop in the pterygomaxillary fissure, and we see that right there. And just like its name says, it's located in between the lateral pterygoid plates of the sphenoid and the maxilla. Now, when we're talking about the fissure versus the fossa, I find it particularly helpful to think of the Pterygopalatine Fossa as a cave and the pterygomaxillary fissure as the big gaping entrance to the cave. So we can walk into the cave through this fissure, but there are going to be many more things and passageways within the cave itself. All right, the boundaries of the Pterygopalatine Fossa are very similar to the pterygomaxillary fissure. So we've got maxilla anteriorly and the greater wing of the sphenoid posteriorly. But because the fossa is three-dimensional instead of two-dimensional, it's also going to have a roof and a medial wall. So the roof is made up of the body of the sphenoid and the medial wall by the palatine bone. Now, the Pterygopalatine Fossa is tiny. There is really only enough room in here for the pterygopalatine ganglion and the nerves traveling to and from it. Maybe a couple of tiny blood vessels. But there's no muscles or glands or anything like that. So I like to think of this area as more of a traffic hub than a home, with things traveling in and out on their way to some other region. And one of the things that makes this possible is an extensive network of communications with other neighboring regions of the head. All right, so we've already named the pterygomaxillary fissure, which opens into the infratemporal fossa. If we move medially, we find the sphenopalatine foramen, which will take us into the nasal cavity. And now I'm going to have you jump over to the right side here. Posteriorly, on the body of the sphenoid, we have two passageways, both of which are going to lead back into the middle cranial fossa. The one that just popped up here is the foramen rotundum. That's the more superior of the two. And the pterygoid canal will be more inferior. Foramen rotundum hopefully sounds familiar to you by now because that is the passageway that the maxillary nerve is going to take out of the cranium. All right, anteriorly here we have a communication with the orbit and eventually out onto the face through the inferior orbital fissure. And finally, inferiorly, we have the greater palatine canal, which leads into the oral cavity and onto the palate. Now, we've got a lot of communications, so we've got a lot of things passing in and out. We have our permanent resident here, which is the pterygopalatine ganglion, and that is really what takes up most of the room in this fossa. This is one of our parasympathetic ganglia, and it's housing postganglionic cell bodies for neural pathways that are headed to the lacrimal gland and to the mucus glands in the nasal and oral cavities. It receives parasympathetic preganglionic axons from the facial nerve via its greater petrosal branch. So facial nerve, greater petrosal, and then to pterygopalatine ganglion. The rest of the structures in the pterygopalatine fossa are kind of playing peekaboo as they move in and out of the region. These are going to be branches of the maxillary nerve as it comes out of foramen rotundum, and branches of the third part of the maxillary artery. And I'm going to leave that description intentionally broad for right now. Both the maxillary nerve and the maxillary artery have their own learning objectives in this session where we're going to track down these individual branches. So for right now, it's good enough to say this is going to have branches of maxillary nerve and branches of maxillary artery passing through its many little foramina. And that brings us to the end. So here is your practice question. Tumor near the sphenopalatine foramen may impinge on structures traveling between the pterygopalatine foramen and which other space? And the correct answer is B, the nasal cavity. So that sphenopalatine foramen is on the medial wall of the pterygopalatine fossa, and that means it is on that deep wall inside there. That will take you into the nasal cavity. Excuse me. And that was where we saw that nasopalatine nerve and sphenopalatine artery travel to the lateral walls and down the medial septum to get to the anterior palate. And that will bring us to the end. Thank you very much.